Hello and welcome everyone to the inaugural episode of Vital Conversations. This podcast is particularly designed to educate and empower healthcare providers on critical issues across the industry. We're talking mental health, business, all kinds of things that just deal specifically for healthcare providers. This is brought to you by Mededge MEA as well as MedXBay, and I am your host, CEO of MedXBay, and I'm thrilled to have something, to be a part of something that is just so amazing and focused on healthcare providers because they are so often forgotten about. We don't talk about them enough. We talk about them in the sense of what they can do for us, but we don't nurture them. And that's what this podcast is all about. And I am so honored to have on our very first episode with me Magda Snowden, who is an amazing, and you're gonna hear everything that she has to talk about in this episode. But I mean, truly amazing, walks the talk, has lived this life, knows it better than anyone else in the healthcare industry for over 20 years. She is a mental agility expert, a healthcare leadership coach. And I mean, honestly, her resume goes on and on and on, but we're going to jump right into the good stuff because what this topic of mental health for healthcare experts is critical. Thank you, Magda, for being here with me today.
Thank you, Yunche. Happy Friday. It's nearly the week. I am really so honored to be here with you on this platform and to be having this kind of discussion because over the past few months, we can see that mental health is gaining traction, the conversations about mental health. And obviously, the two of us, we sit in the space of healthcare. We advocate for opening up the discussions specifically for healthcare providers because who looks after those who are looking after us? And I think this is a really powerful question to start the discussion with.
Absolutely. Let's set the tone because I want people to understand you didn't come out of the woodworks. This isn't your first rodeo. Let's talk a little bit about your background so that people understand you understand this intimately.
Yeah, so I am a senior nurse leader. I've been in nursing, as you said, for over past 2 decades. I have worked in both public and private healthcare systems. So I have worked in the UK, Kuwait, and Dubai. Obviously, nursing was my passion since very beginning. However, I did my nursing studies as a mature student. But there's always you will find a way to follow your passion and to make things happen. How mental agility came into picture is out of frustration, actually. So my story as a healthcare professional doesn't come from a burnout. My story comes from frustration, from seeing the same systemic issues, the same challenges that healthcare professionals are being faced with. Doesn't matter the geographical location, doesn't matter whether it's private, whether it's public. So I have seen it early on in my career working in the NHS in the UK that yes, stress is a part of life. But what became obvious to me um, moving across through these different healthcare systems is that we as humans are lacking skills to navigate these stressors. And you can imagine that healthcare is an extremely fast-paced environment. Specifically now, we are now based in Dubai. So the AI, speed of innovation, abundance of technology, information, resources, this is all good. But have we developed our skills on a human level to be able to leverage this abundance?
That is a fantastic question. I mean, if you're taking a look at the scope of what they learn in school versus the reality of what's happening to people today, I would have to say some of it isn't translating and pulling through all the way, which I'm sure is contributing to some of that mental stress and burnout, right?
Yeah. It's almost like we have created a reality, but we didn't upgrade our human skills. So it's like the world is running very fast and is over there, but we are still here with the same type of skill set, with the same type of leadership. And we just cannot move forward with um, tools and skills that were applicable 10 years ago. Because I'm not saying that, they were bad. The type of leadership or the skills that we utilized a couple of decades ago or even 5 years ago. It's just the world is evolving, or it's even a revolution. Some call it evolution, I call it revolution. Is the speed of progress is now at unprecedented rate. We really also need to start investing in our human skills so we can thrive, not only survive.
Absolute. I love that. Thrive, not only survive. It's something I personally say quite a bit. So, translating that for healthcare providers, I'm sure it's something that maybe they don't even think about because they're constantly worried about their patients. So, let's talk a little bit about the daily load, like the day-to-day workings of just being a healthcare provider, no matter what area or specialty they're in. What does that stress look like? We're talking paperwork, scheduling, systems, kind of give us some insight into what that looks like and what's contributing to some of that mental stress.
A very interesting question, and thank you for this. Actually, I study in depth the research, the statistics, the data point specific to healthcare, stress, burnout, and how to move from that narrative. So there are studies, for example, on main stressors that people face in healthcare, working in healthcare, and there are people related, technology related, and processes related. And if you are to take a guess, which one out of these factors is causing the most stressors for humans?
I would imagine technology.
Well, actually not. They are people-related factors.
It's people related. Interesting. Okay. Well, why is that?
Exactly. Why is that? It's very interesting, to unpick. Uh, and for someone who has worked, obviously, in healthcare, I was a nurse on the floor. So I can kind of even recall specific examples from my nursing practice, and also from the times when I started coaching for mental agility, stress, burnout prevention. So, majority of conflicts, if you look at organizational level, even within a small team, is our majority of the time they happen because our emotional intelligence or mental agility is not developed to a good level. So we take things personally. And what happens when we're taking things personally? And then you imagine that organization is going through a transformation. So there is a lot of technological advancement, new processes. So then you merge the three and you have a recipe for disaster. How this individual who has not developed their human skills is gonna cope with this? It's just continuous cycle.
Oh my goodness. That's it's such an interesting thing because they're working with people all day long. Their entire job is focused on people, and knowing that there is this gap, it makes me wonder about the next question I have about the fear of seeking help. I would imagine that to a certain extent, healthcare providers, doctors, especially ones who dealing with rare diseases and things like that, they are put on a pedestal. They are seen as the pinnacle of success. You have this, you've broken through to something, you discovered something, and here you are supposed to be this epitome of something in the medical field. But when it comes to asking for help, in your experience, why isn't it happening more often, especially from a mental health perspective?
Hmm. I think here comes the hero narrative, something that I discuss extensively. I do training, coaching, and public talks on the hero narrative. So in healthcare, we used to, and we still call nurses, doctors, the healthcare heroes. Of course, it feels good when you are appreciated, when people are clapping for you, like during the pandemic, it feels extremely rewarding on a personal level. However, people who are called heroes, they struggle to ask for help. Because when you think about the hero narrative, it is someone that is continuously giving and not receiving so much. So you are continuously pouring from your cup. And if you are not refilling this cup, then, at some point you are gonna come to the red light or your cup is gonna be empty. And what is gonna
I gotta give.
Yes, the demand is still there and you have nothing else to give. That's why I think the narrative shift from hero to human, and this is something that I advocate for. We need to start acknowledging our own humanity. With what does it mean? That as humans, we have limits. We are not the superhero flying around 24/7 answering every single call for help. Maybe we wish we could be these superheroes, but we are humans. And, acknowledging this humanity, and with this comes the concept of managing our own resources, our own energy. So I cannot be everywhere all the time. And if I come to a situation that I am challenged or I am stressed, how can I help myself? How do I open this conversation and start asking for help? So this is something that is not so common still in healthcare. For healthcare professionals to say, I am really overwhelmed, I cannot deliver safely the care to our patients, what needs to happen then? So like on one side, we have the inability of the healthcare professionals to ask for help. And on the other side, we can see that the systems are not ready to facilitate this kind of discussions. There isn't enough support mechanisms in place.
That's it's such a kind of a chicken before the egg kind of situation, right? Because we all know that if a system requires a human being, the energy output can only be so much. And if you overwork that, then you begin to deteriorate the quality of that. We know that inherently, but yet we don't apply it. And it always makes me wonder because that's a commonality thing across all corporations. We overwork our people, some of our best assets and our resources to the point of extinction, and we don't learn the proper lesson. So it's like, what is it going to take for this to be a pivotal part of the conversation and not just a nice to have? What do you think?
Mm. I believe here in the UAE, we are at a very privileged position because the government has announced the mental health strategy, right? They're investing a lot of resources to try to raise awareness, to destigmatize mental health conditions, to give people the voice and the opportunity to create safe spaces when individuals can come and ask for this help. Again, the root cause is really complex. It's not just the two of us are just sitting here and saying the situation is bad and this is what needs to happen.
Right.
Me being really on the floor working in these hospitals, I know how complex it is when you get extremely busy, when your resources are not there. We resort to being reactive instead of being proactive. And when we say that we don't learn, sometimes we don't have time to learn. I know how quickly the changes happen, how sick your patients can get. This kind of situations almost call for a situation when you need to come to a standstill. And when can you come to a point of standstill so you can appreciate that there are different ways of working? There are different ways of being. So the perception is that either I can have mental health or well-being or professional success. And this is where majority of individuals sit, that I have to suffer when I'm a nurse or a doctor and I want to reach a certain position or I want to be successful, I need to compromise something. Actually, we are breaking the myths in here. We don't need to compromise our own mental health. Stress and burnout is not a mandatory tax, but we need to pay the professionals that they hate you.
Oh, that needs to be on a shirt.
Absolutely.
It is not a tax you have to pay just to help others. That is, if you don't take anything away from this episode, take away that. Like, that is a crucial learning point because one of the next questions that I have is exactly leading into family, right? In personal life. That I have a couple of, quite a few friends that are actually doctors, and I can't tell you, it's like a joke that it's like, "Oh, yeah, when you're in med school, and you're married, you're probably getting a divorce." So it's almost inevitable that it happens, and knowing the sacrifices for the time just in med school, not even when we're talking about residency and then having, then going on, it is a known thing that you are going to sacrifice and potentially lose some of your personal life in order to achieve this thing. So from the moment they're beginning that education all the way pulled through to them actually being a doctor, they are inheriting this behavior and it's pulling through. How can they begin to work? Because, new generations are coming in, new mindsets are coming in, and people do want a better work-life balance. How can they even begin to achieve that when this is kind of some of that foundational behavior that they're taught?
As you said, Yunche, this is an inherited narrative. So we're just accepting something consciously, unconsciously, and we are just going with this story. And what happens also on individual level, when you accept someone else's narrative, you have no control over the situation. It's not you who is writing the story of life.
Very true.
We need to start questioning the status quo. We need to start questioning that narrative. And I think the frustration that came to me on many occasions luckily led me to a creative space, and I started really questioning. I said, no, we cannot continue this way. I became a nurse to serve others, but also I want to thrive in my role. And there was a breaking point, actually, a turning point in my career during COVID, when I was in charge of a COVID field hospital here in Dubai. And when I tell this story to my friends, they're almost laughing because I said I made a conscious decision for the team and myself that we are gonna thrive, not only survive. We're not gonna watch the news every day and get panicked. Oh my God, what is gonna happen? We need to make the best out of this situation. And I think that crisis situation really helped me see another way of doing and being. I embrace the psychological safety, human leadership style. How do I need to change? How do I need to adjust myself to be able to see the human in front of me in the whole glory, if you wish, not just a nurse, a doctor, or a complaining patient, or, low performer, high performer. For me, that was a narrative shift.
That that is such a powerful choice that you made because you could have continued the status quo, what you saw, but you said as a leader, I'm making this choice for us because you're future proofing their ability to be able to give you the best versions of themselves. And that equals you have to create the environment for balance. And throughout the medical field, I imagine it is so hard to do that because you got a patient that's coming in that's bleeding out. You're not thinking about balance. You're thinking about how do I save this life in this very moment in time. So for those who, especially in, the ICUs, I can imagine. I was speaking to a doctor recently and he was like, one of the things that is our most difficult thing to deal with is burnout. And in the ICU, it is utterly impossible. And these young people are coming to me every day. And he said, frankly, we don't know what to do about it. We're just trying to manage the schedules the best that we can, but we don't have enough people to fill the positions that are needed to give them the time off. So when we're dealing with a deficit like that, and you have these institutions, and you're working at such a high level, what are some things that people can do in a situation that feels impossible, and they're trying to just take back a little bit of time, just a little bit of sanity? What are some of your recommendations?
Mm, I think the answer would be different when I'm talking to an individual and slightly different at our organizational level. However, the answer needs to come from a collective point. So, if we have a situation in a unit or in our organization, it needs to be the whole system acknowledgement of the situation. Number one, we need to acknowledge. Because my magic formula that I apply in my coaching, mentoring, training is like with awareness comes choice. So when we know something, we acknowledge it, we can make a better choice. And we do this choice, we're gonna have a better outcome. It's always this way. So acknowledge what is happening. If individual level, what is within your control? What you can do about it? Knowing what you know about stress and burnout. And we need to go deeper into understanding what is actually stress. Because imagine that when I work with individuals and I ask for definition, people will name a million different things and they will continue saying, I'm stressed, I'm stressed, I'm stressed. For brain to find a solution, brain really needs to understand what is it that is stressing you out. So even the simple science, like what is stress, what is burnout, what are the statistics, these are the data points. So now we can slowly start making a plan to make a better choice. So always start simple. And I say even mental agility is a huge, complex concept, and people keep asking me for definitions. Always go to the simplest possible definition and the simplest possible solution, not to overwhelm. For someone who is already stressed and burnout, I don't want to come with a huge, overwhelming concept. Just tell them this is easy.
Yes. No, that makes perfect sense. I'm going to ask you about a concept that's a little bit more complex now because this is dealing with AI, with technology. It is a massive buzzword across medical, and some are for it, some are against it, especially because they feel like, oh, it's going to take my job, it's going to replace me. Others are like, yes, it's going to do all of these amazing things without thinking about all of the systems and, you know, how it can create impact in the future, not just in the immediate. AI has so many potentials and possibilities, but it is already starting to wreak a little bit of havoc from a mental health perspective. So I imagine you've had people come to you, talk to you about just any aspect of AI and their concerns about it across medical. What are your thoughts about the implementation of AI, it being used in the administrative format to accelerate the way that we're doing things, and how can that what's your foresight on what you think that how that can impact mental health for healthcare providers?
Hmm. Again, this is one of my topics of interest, which I research a lot. But also, I remember when AI first came into play, and I was still in a clinical role. I was a director of nursing at that point. I remember the stress that individuals suffered even when someone told them you need to innovate, you need to think outside the box, AI is gonna take your job. And again, if we don't question what someone is telling us and we're gonna go with this narrative, it causes a lot of stress. I've realized even myself as a leader, I need to adjust the way I speak to my people. I need to be really careful about the language I am using. I don't want to cause stress to my nurses, to my clinical educators by telling them guys to think outside the box. I started really questioning the status quo, like what is the box? And those who were saying this, they could not explain. So if you cannot explain it, I strongly suggest you do not use this terminology. Because we pick up a t-shirt slogan, right, of something from the internet, and we keep repeating. Unknowingly, we can cause pressure and stress in our teams. So I suggest really again, go back to the conscious leadership, really know your stuff. Consider other options because there isn't just one option. There isn't just this or there isn't just that. But yes, I am a fan of AI. Technology is a blessing, and technology is a huge blessing in healthcare environments. We know that it can reduce the administrative burden. It can streamline the processes, the communication system. So there is so much advantage in there. It's just the way how we will communicate this transformation or this new technology to our teams. We want to empower them and to feel proud that they have access to this technology and for them to know the benefits. How is it going to help them, not to scare them and to stress them out that AI take your job.
I couldn't agree with you more. One, the conscious leadership approach is it's really gained a lot of momentum. I say in the last 3 years for sure, and I'm seeing it across the board. But in a place that is so personal, healthcare, the necessity to be a conscious leader is more present now that I think than ever before. And in the spirit of being a conscious leader, knowing that your people, your team members struggle to ask for help and are looking for a sense of support, what are some ways that leaders could kind of create some peer groups or like support systems within their institutions, or even maybe offline? Maybe it's just a WhatsApp group with a couple of people that they work with. What are some ways that they can begin that process to make sure that they're offering that support, even if it's not at a level that has a full-blown program? for where they work at? What are some of your thoughts on ways they can do that?
So, one of the things that I teach is that mentally agile leaders start every conversation with what matters to the other person, not what is the matter with the other person. The minute we start seeing the human in front of us, not HR director, a complaining patient, or a IT, a manager or whatever, every time we connect on that human level, then when we add curiosity into the equation, we will start asking the questions to solve the situation, to avoid problem, to avoid taking things personally and creating a narrative in our head. Is a very simple yet very powerful formula. Another thing that I would also add is to do not ask questions why, ask how. So instead, why this incident has happened, how did you arrive in this situation? Talk me through it. There are simple, powerful tricks that we can learn on a personal level to reduce dramatically the amount of stress that we are having on a personal level, the stress that we're having in our teams, organizations. And obviously, this will translate to our personal life. We still go home, we have families, we have friends. We want to bring the best back home, not the worst.
I couldn't agree with you more. I think that honestly, we could probably talk about this for another 2 hours. This topic is so, impactful, and trying to cover it in just 30 minutes is it does it an injustice, but at the very least, we're beginning the conversation. And I think that people need to know that individuals like you exist, especially focused on healthcare providers, that you understand them very intimately because you've worked in the environment, you know it, and they can reach out to you and get that support that they may currently lack, and they're trying to create better balance in their life. So how can people find you? How can they reach you?
So I am quite active on LinkedIn. LinkedIn is my platform, and I also run weekly LinkedIn live sessions on thriving together, unveiling solutions for stress and burnout in healthcare and beyond. So I invite everyone to just drop in on one of our sessions and see how the conversation is evolving. And we are obviously sharing a lot of practical examples, a lot of gold nuggets, something that people can take away with them and apply in their life. And also, I have an upcoming studio podcast. So this is a very exciting project. The series is called From Hero to Human. So again, it's about narrative shift. It's about breaking myths. It's about acknowledging our own humanity and investing in our human skills.
I absolutely love that. And it's something you guys should tune into. It's going to help you if you've never reached out to anyone to help you before as a healthcare professional. You have someone here who can be an amazing resource to you. So, Magda, any last thoughts? Anything you want to leave them with? Any tips or advice?
Just pause. I invite everyone to pause for a moment. Look around you. Appreciate yourself. Appreciate your environment. And don't accept everything blindly. Use your curiosity. Ask the questions. Not the question why, but the question how. How did I arrive at this point? And what can I do for myself to change these situations if I'm not happy with the current setting?
I love that. I truly love that. Thank you so much for being here with me, sharing your insights. I so appreciate it.
Thank you, Yunche. My pleasure.
All right. Signing off, guys.